Hi, my name is Pirina Brando and I'm going to talk about nutritional management of chronic kidney disease. Definition: chronic kidney disease defined as evidence of structural or functional renal impairment for 3 or more months. Is generally progressive and irreversible, affecting multiple metabolic pathways. As chronic kidney disease process, the accumulation of nutrient-containing products from the artery and restricted protein catabolism may destroy taste and smell and blood appetite. Gastrointestinal nutrient absorption ultimately becomes abnormal, since uremia affects the microbiome and disrupts intestinal epithelia. Most colds and fat wasting may develop as kidney failure advances, exacerbated by coexisting conditions and frailty, particularly in elderly patients, who account for a large proportion of those who are affected. Hence, nutritional status often becomes disordered and protein energy wasted is common, requiring dietary adjustments in this population.
Your diet with a renal dietitian can help to improve some of your blood results and slow down the progress of your kidney disease. Although we cannot stop the kidney function decreasing, we can slow down the progress of kidney failure by keeping a healthy weight and maintaining a good blood pressure. If you are diabetic, make sure your blood sugar is well controlled. You are encouraged to keep up some regular exercise according to your physical tolerance. Dietary-wise, you are encouraged to follow a no added salt diet, which means you can use a small amount of salt in cooking, but do not add salt to your food at the table. The national recommendation of daily salt allowance is 6 grams per day, which is roughly equal to 1 teaspoonful of salt. You can use normal sea salt. Please try to avoid using salt substitutes as they are high in potassium.
Application in medicine. Nutritional therapy may help to manage uremia, as well as other complications such as electrolyte and acid-base imbalance, water and salt irritation, mineral and bone disorders, and failed food to drive. In fact, dietary interventions may also be used for the conservative management of uremia or as a means of delaying or avoiding dialysis therapy, according to the patient's preference. Nutritional intervention shows disease progression independence of uremia management, given that approximately 10% of the adult population worldwide has a chronic kidney disease, and considering the exceptional high cost and burden of maintenance, dialysis therapy, and kidney transplantation. Dietary interventions may be increasingly chosen as a management strategy for chronic kidney disease. Pros and cons. Pros. The progression of kidney disease is only minimally declared by the low-protein diet. Restricting dietary protein also results in a proportional reduction in urea generation. In patients with kidney disease, carbohydrates should be complex with high fiber content to help reduce dietary phosphorus and protein as well as urea and creatinine generations. Cons. A micronutrient imbalance in patients with kidney disease may contribute to the higher burden of oxidative stress, inflammation, and cardiovascular disease. Iron deficiency is most problematic given the high frequency of gastrointestinal blood loss in patients with chronic kidney disease.
When your kidneys aren't working as well as they used to, they will lose their ability to remove the excessive salt in your blood. Your body will keep more water in your blood, to dilute out the extra salt. As your blood volume increases, your heart will have to work harder to keep the blood going around your body. This causes your blood pressure to increase. Due to gravity, most of the excessive fluid in your body will accumulate in your feet, causing a condition called oedema. Your face and eyelids may also puff up and you may easily feel out of breath. High blood pressure can cause your kidney function to go downhill quicker.
Issue applied in Ecuador, advanced chronic kidney disease supposes a higher health problem in Ecuador that requires a herbicide approach. Top 10 causes of total modern death in 1918%, chronic kidney disease at number 2. Conclusion: given the high incidence and prevalence of chronic kidney disease and urgent need for alternative disease management strategies, nutritional interventions, and disease-specific dietary range that are patient-centered and cost-effective may help increase longevity and prolong the disease-free international for millions of people worldwide.